Well, good morning. My name is Dr. Dan Feiten. I am a practicing pediatrician at Greenwood Pediatrics on the south side of Denver, 22 provider practice and 3 offices. I'm the co-founder of that group, and I am also a co-founder and medical editor of a company called Pediatric Web, where we provide web design and development for about 200 practices around the country. If you want to look at your wonderful NewSoft iPads, you can click on the little icon that says AAP, the little red icon, and we'll take you through the slides. They're not going to show up here. If you go to the second slide, and I'll kind of tell you when we're changing slides, but if you go to the second slide, there's my information and my financial disclosures. The next slide, Pediatricians Expectations. So I've been doing this for quite some time, and I was back there in the days of the free websites, Medum and Beansprout and some of those other ones. And back in the early days, all we thought of in terms of websites were that they were places for you to put your online brochure, all right? Who's your doctor? Where did they go to school? What color do they like? Who are they married to? And so forth. But we've learned over the last 5 to 10 years that it also is a tool to attract new patients. And people are using new technologies to try and bring those new patients in, and I'll talk about that in a little bit. We also understand that your website is a tool to provide better patient care, and I'll tell you about how some of the websites are using their content and other things to help them to provide better care and also to save costs for their practice. There's also an opportunity to actually generate revenue from your website, and we'll talk about that in just a little bit. In terms of content, in the early days, it was all keep it simple, let me write a few little things, etc. But when I first got started, I actually started the practice and I met with 10 mothers in my practice, and I said, what do you want? How can we help you? And they said, we want information that tells us what to do when our child is ill. And so I went home, I wrote 4 pages on vomiting, brought it back to this table of 10 mothers, and they politely all read it, and then they were kind of waiting for the first person to say something, and one woman finally said, you know, when my child is vomiting, I don't have time to read 4 pages. And so we came up with an entirely different concept that was very quick, very tabular, and we were able to take that into putting it online and providing websites and all that kind of stuff. In the very beginning, everybody thought that Medum and Beansprout, etc., should provide these things for free. They got 16 million and I think it was 22 million. I don't want to quote that, but that's about how much they got, and neither of them are in existence today. Now pediatricians are looking for value. If you move to the next slide, which is parents' expectations, I think this quote says what we as pediatricians probably sometimes mistake what our website is supposed to do. All right? We think that parents want a drill machine, but what they want is a hole in the wall. They have a function that they're looking at from your website, and they're expecting something to be done. They have a task to do. Their child is vomiting. Tell me what to do. In the next in the next slide, you'll see that their expectations are also such that they now, at least 400 million of them, are carrying around their iPhone or their Droid. They are used to top-line technology, technology that is intuitive, it is simple, straightforward to use, and they don't want to mess around with cheap, dingy websites that your nephew's young brother designed for you one night. Their expectations are much, much higher now because of what Apple and Droid and Google have brought to the table. The next slide is what your parent is thinking about when they go to your website. Don't make me think. This should be simple and straightforward. Google can do it, and Apple can do it, and why can't you? And they're actually judging your website by looking at your competitors' websites, and some of them are actually making choices based solely on what your website looks like. In fact, our data shows that about 18% of parents choose your practice not from a referral, not from going to the insurance company, but simply typing in pediatrician in Denver, Colorado, checking out all the websites, checking your bios, etc. They want good design. They want something that's intuitive. On the next slide, I want to share with you some data where we took a survey of parents, and over 2,000 parents looked at this or took this survey over 4 months on our network. We used the content by Dr. Bart Schmidt that we call Is Your Child Sick? It is an online triage and advice system, and parents, 61% of them said that that saved a phone call to their office, to their doctor's office. They didn't need to make that phone call. That's a significant savings. In my own practice, my practice has grown by 25% in volume over the last 5 years. Our answering service fees and our nurse triage fees are almost exactly the same as they were 5 years ago because parents don't call us as often. Interestingly, of those parents that were online, 93% said that they want to find that content on their pediatrician's website. They're beginning to understand that you are the medical home for their children. They don't want to go off to links. They don't want to go off to some other big website where they have to search. Remember the theme, don't make me think. Have it right there, have it on your front page, etc. On the next slide, we go further into this particular survey where we learned that parents rated what are the most important features that they want on a pediatrician's website. 92% said, I want Is Your Child Sick? That's very important. Actually, 99% said that it's important, but 92% said it's very important. 72% want a patient portal. Notice that at the bottom, only 31% really cared about a picture of your office staff on the website. That's not what they're going to the website for. They're not thinking to themselves, boy, I wonder what the people at Dr. Dan's office look like. I think I'll go there and find out. Next slide, when designing your website, I think the key thing is to focus on the task that the parent has. Why are they coming to your website? As I mentioned, they're coming mostly or significantly because their child is ill. Here's a website from East Valley Pediatrics. You can see that they have it designed based on the tasks that the parents have to do. They wrote down and said, what are going to be the top reasons that parents will come to our website? And the top reason, 48% of the time, they come to Is Your Child Sick in the lower left-hand column. 32% of the time, they also hit medical resources. They want to know what's new in the practice. On the right-hand column, remember 72% wanted a patient portal on the website. That's their patient portal. But they didn't call it patient portal. They highlighted it with pictures and set it up so that it's very simple. I want to make an appointment. I want to refill a prescription, etc. They didn't put a link first that said patient portal. They put the function, they put the task there on the website to avoid thinking and going to another page. And then they also put on information about why people should choose East Valley Pediatrics. As I said, the number one reason that parents are coming to your website is they want help with their sick child, and don't give them 4 pages to read through. I want to comment for a second in terms of the next phase of physicians' ability to communicate with their parents. And probably one of the critical things that you need to be thinking about is getting your website to go mobile. Over the next 6 months, New code called HTML5 is going to be finally adopted, and we will see that that code specifically will really focus on some of the tools that we need for good mobile websites. If you move to the next slide called Mobile Facts, I mentioned that smartphones are now making up 40% of all mobile phones. People predict this year there will be 400 million smartphones that are purchased at the end of 2011. By 2015, it's expected that 1 billion will be purchased in 2015. If you move on down to Mobile Facts, you'll see a slide there that just lists the use for PCs versus the use for tablets. As you know, tablets are going to be a big thing. And then in the next slide, it says bounce rate on a smartphone, mobile site versus a website. We took the data from our 200 websites, looked at the ones that had mobile websites, and looked at the ones that just simply had regular websites. And we found that the bounce rate, now the bounce rate is those people who come to your website, they look at it, and they don't do a single thing. They don't click on it, they don't move to another page, they just see it, and they go, I don't need that. They hit the red X, and they click out of it. That's the bounce rate. The bounce rate for websites is typically somewhere between 35 to 42% because a lot of people are Googling and they're looking for something. They get to you and they go, no, that's not what I wanted. But for people who are using your website, the bounce rate is significantly less for people who use mobile. And so if you have a mobile website, it's a significant use of your website. People are coming via mobile because they know you, because they want a function done. 18% of the people who reach Facebook reach it by their mobile phone, and that is expected to increase significantly. Only 4% reach it by an iPhone app. If you move down to the next slide, it says attracting new patients' first impressions. One of the things that we have found is that, well, we all know that yellow pages aren't used anymore. I don't know when the last time was that I used a yellow page. But as I mentioned early in the talk, parents now look at you first before they come in for a prenatal visit or a to-meet visit or whatever you call it. They're checking out your website. And my friend Dr. Noah Makovsky said to me that they did a little survey and they found out that more than 95% of parents who came to their came to their practice checked them out ahead of time, and that helped them to make decisions. If your website isn't up to date, if it isn't the latest, people are making decisions, unfortunately, because they're thinking if you can't keep that up to date, maybe you're not up to date in your medical knowledge and so forth. That's not necessarily a fair assumption, but that's what they're doing. I wanted to just give you a sense on the next website, Attracting New Patients, Greenwood Pediatrics. We looked at our patients that we got last January from patients who just simply came to the Greenwood Pediatrics website and they made the decision to join Greenwood Pediatrics, again, not because they had a good review from a neighbor, not because they got anything from their insurance company. They didn't look on health grades or anything like that. They just judged us on our website alone. We had 16 new patients last January. We've been tracking the numbers, and it looks like probably this year we will have received $19,000 in income just from those new patients who chose us because of our website. So if you're thinking that your website costs too much, think about the return that you're going to get from the impression that people get from your website. So I want to just mention a few things about the future of pediatric websites. Think mobile, because tablets and mobile are really going to be the big thing thanks to new technology, new coding. Think about your content management system. Content management systems now are really an important factor in your website, allowing you to create your own website or make the changes in design, etc. add widgets, add all kinds of tools, etc. Think about rating systems that you can add to your website, whereby a patient may be able to go online and actually rate you or give you feedback for your practice. I'm on the website that says the future pediatric websites. It starts with analytics. One of the things that you're going to see and that we're using now with Pediatric Web are more analytics. A/B testing is where you put up one design of your site and another design of your site. Half the people are going to this site, half the people are going to that site, and we're actually looking to see where do you put "Is your child sick" on your website. If it's in the lower left-hand corner, are they going to use it much more than if it's in the upper right-hand corner? Those are tools that are coming about. We're looking at personalization so that somebody comes onto your website and you're able to look at the kinds of things that they want, the kinds of things that they need. If you haven't put your website, or excuse me, if you haven't put your practice on Google Places, you need to do that because Google just added Google Places to their mobile local, it's called, all right? So when somebody's searching for a pizza and they're looking at the map, not only will the pizza place show up, but anywhere Pediatrics will show up, and that's a critical thing and an easy thing to do. I'm going to skip that for sake of time. So remember, you want to focus on the task that the parent has. The second axiom that I mentioned is don't make the parent think. If you move on down to the slide that is a to-do list for next week, here's some things that I'm suggesting that you get started right now to make your website a little bit more user capable. If you haven't gotten onto Google Analytics, do that. It's simple and straightforward. Just go to google.com/analytics. Register your office on Google Places. As I said, it'll take you about 15 minutes. Put a QR code on your business cards. If you don't know what that is, that's that strange design that's in the lower right-hand corner. Parents are, young parents understand what that is, and if you take a picture of that, or if you want to grab one of my business cards, I'm right back there at that monitor right there, and I've got a QR code on there, and it will certainly give you all the information about me other than my dog's name. You want to check for dead links on your site. You're just going to go to validator.w3.org. You're going to put your website in there. You're going to find out what links aren't working. You want to check the spelling of your website. I mean, if you don't have good spelling, parents are going to go on and go, how well is this being kept up to date? Those are easy things to do. In the next 3 months, you want to research the sites of your competitor practices. Look at your content management system. Ask whether or not it really does what you want it to do. Focus on the task. Get yourself involved in some search engine optimization to bring your website up. Add a mobile website. Think about how you're going to use social media. Well, we have over 200 practices. Only about 30 of them are using Facebook right now. Why? Because it's too much work. In terms of the to-do list, I'm going to just leave that on the slide. Think about adding that patient portal that 72% of people want. Think about adding video, blogs and forums, and newsletter solutions. And I will make that my final word. Does anybody have any questions?